Welcome to the webinar on biomedical waste management from COVID-19 patients. The session objective: describe the process and special guidelines as per the Central Pollution Control Board for biomedical waste management generated from treating COVID-19 patients. So, in the view of COVID-19 outbreak, the Central Pollution Control Board has released guidelines for handling, treatment, and safe disposal of biomedical waste generated during treatment, diagnosis, and quarantine of patients confirmed or suspected to have the novel coronavirus disease, in addition to the BMW Rule 2016 rule. And it is made mandatory to put COVID-19 waste label. So that is the most important thing. It need to be segregated separately and need to marked or labeled as COVID-19 waste, in addition to or the rule BMW 2016 rule. So let us look at the process of BMW. The process of biomedical waste management starts from the generation. Once the biomedical waste generated, we have to segregate it, then store, then that will be collected and transported, and treatment and the disposal. And this is the common step we all hospitals are following it, from generation to the disposal, and these all are the steps which we follow. So once the waste generated, we have to segregate it. How we can segregate? We can segregate different waste accordingly into the different waste categories and into the different bins. For instance, the first category of waste, that is what human, anatomical, and soil waste, and this can be collected or segregated in yellow bin that contains human anatomical waste, for example tissues, organ and body parts, animal anatomical waste, soiled waste such as dressing, plaster cast, cotton swabs, discarded linen, mattress, beddings, blood bags, and discarded or expired medicines, cytotoxic drug. These all things can be segregated in yellow bin. Coming to the next bin, that is the red bin. And in the red bin, what type of waste we can segregate? All infected plastic and rubber waste we can segregate into the red bin, such as waste generated from tubings, plastic IV bottles and IV tubings, BT sets, gloves, urine bags, catheter, drains, and syringes without needle can be segregated in the red bin. And coming to the blue bin can be for all broken and contaminated glasswares. All broken and contaminated glasswares can be segregated in blue bin. It can be a cardboard box, or it can be a plastic bin, as which you can see in the picture. So like all infected broken glass bottle, broken or unbroken glasswares and vials and ampules, except cytotoxic waste, because that will be going into the yellow bin, cytotoxic drugs. And blue bin can be used to segregate these all waste. Coming to the white container. In white container, it should be a puncture proof, leak and tamper proof, only for sharp items. Like what all the sharp items we can for the white container, like it can be like waste sharp, including metals, needles, syringes with fixed needles from needle tip cutter, or scalpels, blades, or any contaminated sharp object can be segregated into this white puncture proof container, which you can see in the picture also. You can see. So all these container, we have to mention that the biohazard, that sticker should be there for all the container. The last one, that is a black bin. The black bin is for all general waste. The black bin is non-infectious general waste, like you can appreciate from the picture, like food waste, mineral water bottles, and paper waste we can segregate into the black bin. So this is the segregation parts. So as per the BMW Rule 2016, once we segregated in yellow, red, white, blue and the black, then depending upon the type of the waste and depending upon the type of the waste, the treatment and disposal options are followed. So for instance, if it is an yellow category like human anatomical waste or the soiled waste, that can be treated in incineration, or maybe a plasma pyrolysis, that is also used by the used in the high heat we are using in that. The next one category is the red, white and the blue. These three category almost follow the same type of treatment or a disposal option. First they have to sterilize by doing autoclaving. Then after that we can be it can be recycled if possible. So before that they will undergo various shredding procedure, or then if it is possible then we can recycle it, or we can send for recycling. So depending upon what type of waste it is, the disposal and treatment options are follows. So let us look from generation to disposal process, what all are the steps and how we do that in AIIMS. So step 1, BMW is collected from various sites in appropriate location. So you can see in the picture that from different location and different bag or different bins, the BMWs, the biomedical waste is collected from various sites from the appropriate location. Then once the waste is collected from color coded bins, then the bags are loaded into the trolleys. That is the second step. Then once this trolleys, the third step is what? The trolleys from all over the hospital transport the waste, and they will be stored in a temporary storage facility. That will be for a maximum or for a less than 48 hours we can store that. Okay. Then after that the bags are weighed and barcoded. That is the step 4. Then step 5, all the collected bags are loaded into a special biomedical waste truck and are transported to a common biomedical waste treatment facility. So these all things you can appreciate from the picture too. So these are the steps from a generation to a disposal process. So then I said in the beginning, in the view, along with these BMW 2016 rules, Central Pollution Control Board released following specific guidelines on 25th March 2020 in the view of COVID-19 outbreak. So that we have to see. Let us see what all are those specific guidelines. The first section is for COVID-19 isolation ward. The specific guidelines are: keep separate color-coded bins, bags, containers in wards and maintain proper segregation of waste as per Biomedical Waste Management Rule 2016. As precaution, it is always recommended, they recommend that double-layered bag using 2 bags should be used for collection of waste so as to ensure adequate strength and no leak. Use a dedicated collection bin as labeled as COVID-19 to store COVID-19 waste and keep separately in a temporary storage room prior to handling over to the concerned staff. And biomedical waste collected in such isolation ward can be also be lifted directly from the ward to the common biomedical waste treatment facility or a collection one that can be done. In addition to the mandatory labeling, bags or the container used for collecting biomedical waste from COVID-19 ward should be labeled as COVID-19 waste. This marking will enable the team or the common biomedical waste treatment facility team to identify the waste easily for priority treatment and disposal immediately upon the receipt. General waste not having contamination should be disposed as solid waste as per the Solid Waste Management Rule 2016. The continuation in the isolation ward specific guidelines, that is, we have to maintain a specific separate record of waste generated from COVID-19 isolation ward, use dedicated trolleys and collected bins or in COVID-19 isolation wards. A label COVID-19 waste to be pasted on these items also. The inner and the outer surface of the containers, bins, trolleys used for storage of COVID-19 waste should be disinfected with 1% sodium hypochlorite solution daily. Then we have to report an opening or an operation of a COVID-19 ward and a COVID ICU to the state pollution control boards and to the respective common biomedical waste treatment facility located in your areas. And depute dedicated sanitation workers and separately for biomedical waste and general solid waste so that waste can be collected and transferred timely to the temporary waste storage area. Regarding to the standard precaution to be followed by healthcare workers while handling dead bodies of COVID-19 patients, that start with hand hygiene and use of personal protective equipments such as water resistant apron, goggles, N95 mask and gloves, safe handling of the sharp. All the biomedical waste must be handled and disposed in accordance with the biomedical waste management rules, which we discussed already. And all used and solid linen should be handled with the standard precautions. Put in biohazard bag and the outer surface of the bag disinfected with the hypochlorite solution. This is especially in concern with the dead bodies or the waste generated in relation to the dead bodies of COVID-19 patients. The second section, that is if the responsibilities of a person operating quarantine camps or a home care facility. We are expecting a very less quantity of biomedical waste from these areas like quarantine camps or homes or home care facility. So what we can do, the general waste generated from the quarantine centers or camps should be handed over to the waste collector identified by the urban local bodies or as per the prevailing local method of disposing general solid waste. And if there are any biomedical waste, if any generated from the quarantine centers or camp, should be collected separately in an yellow colored bag or a suitable colored bag which is provided by the urban local bodies. And these bags can be placed in a separate and dedicated dustbins of appropriate site. And the person operating these quarantine camps or the center should call the common biomedical treatment facility operator to collect the biomedical waste as and when it is generated. Or you can contact the contact details, you can get it from the local authorities. Coming to the role of a nurse while dealing with the biomedical waste of COVID-19 patients. What are the main role for the nurses? And the most important that we have to adhere to the Biomedical Waste Management Rule 2016 and special guidelines released released for the management of biomedical waste of COVID-19 patients. Display the biohazard symbols, COVID-19 label, and the type of waste to be put in each bin as per the BMW rules. Do a regular check and supervise and whether they are following these biochemical rule they are segregating in a proper way or whether they are adhering to it. That all thing you can have a regular check and supervise all the others too in your department. Use personal protective equipments while handling the waste and emphasize the importance of hand hygiene and refrain from touching the face, mouth, nose and eyes. With that we can educate the sanitary workers or whoever is handling the waste. You can educate them for a proper use of PPE and hand hygiene and this activity. We never transfer sharp directly from person to person, and we have to maintain a biomedical waste register or a record. This is the thing will be the record sample will be like that, like this, what colored of bags, how many numbers with red, black, yellow, blue, and what are the size of it, then handed over by staff nurse and handed over to, and when it is received at the treatment facility, and that all thing we can mention in that record. So this is the sample for it. And to conclude, the proper biomedical waste management can control of spread of infection. Healthcare facilities having isolation ward for COVID-19 patients need to follow these guidelines to ensure safe handling and disposal of biomedical waste generated during treatment. Guidelines brought out by WHO, Ministry of Health and Family Welfare, ICMR and other state concerned agencies. You need to look time to time and this may be then for in that look time to time, and that can also refer in dealing with the biomedical waste management. So these all are certain web link I have mentioned here, like web link of Ministry of Health and Family Welfare, our website, that is AIIMS, and the pollution control website. So you can look into these website for more information. Thank you so much.